Hi, friends, welcome to my YouTube channel Nursing Classes, a place where you get nursing competitive exam MCQ and theory classes. आज की इस वीडियो क्लास में हम ओडिशा माइनिंग कॉर्पोरेशन नर्सिंग ऑफिसर एग्जाम 2020 का क्वेश्चन सॉल्व करने जा रहे हैं। शुरू करने से पहले अगर आप लोगों ने मेरी YouTube चैनल को सब्सक्राइब नहीं किया है तो सब्सक्राइब करें और बेल आइकॉन को क्लिक करें जिससे मेरे आने वाली वीडियोस का नोटिफिकेशन पहले मिलेगा। अगर वीडियो अच्छी लगी तो एक लाइक कर देना और अपने दोस्तों के साथ शेयर करना। चलो अब शुरू करते हैं। 41. Pancytopenia is A. Decrease in platelets, B. Decrease in white blood cells, C. Decrease in red blood cells, white blood cells, and platelets, D. Decrease in red blood cells. Correct answer C. Decrease in red blood cells, white blood cells, and platelets. 42. In the PQRST scale used for pain assessment, the alphabet P denotes A. Provoked, B. Presence, C. Pattern, D. Perception. Correct answer A. Provoked. 43. Which of the following is one of a major criteria for the diagnosis of rheumatic fever? A. Previous rheumatic fever, B. Fever, C. Arthralgia, D. Subcutaneous nodule. Correct answer D. Subcutaneous nodule. 44. Which of the following is also known as the pacemaker of the heart? A. SA node, B. Bundle of His, C. AV node, D. Purkinje fibers. Correct answer A. SA node. 45. Use of too large or too small cuff size to measure blood pressure will result in A. Loss of Korotkov sounds, B. Doesn't affect reading, C. A false reading, D. Injury to the patient. Correct answer C. A false reading. 46. In which year expanded program on immunization was launched in India? A. 1982, B. 1978, C. 1976, D. 1980. Correct answer B. 1978. 47. Lack of surfactant in lungs may lead to A. Lung collapse, B. Increase in surface tension of the alveoli, C. Expansion of chest cavity, D. Hyperventilation. Correct answer A. Lung collapse. 48. Which of the following are not the negative symptoms of schizophrenia? A. Second person hallucinations, B. Blunted affect, C. Asociality, D. Anhedonia. Correct answer A. Second person hallucinations. 49. A client with major depression undergoes a sixth electroconvulsive therapy treatment. When assessing the client immediately after ACT, the nurse expects to find A. Transitory short and long-term memory loss and confusion, B. Permanent long-term memory loss and hypomania, C. Transitory short-term memory loss and permanent long-term memory loss, D. Permanent short-term memory loss and hypertension. Correct answer A. Transitory short and long-term memory loss and confusion. 50. After an initial skin assessment, the nurse documents the presence of reddened area that is blistered. According to staging system, this ulcer has been classified as A. Stage 4, B. Stage 3, C. Stage 1, D. Stage 2. Correct answer D. Stage 2. 51. The fever in which the body temperature fluctuates minimally but always remains above normal is called A. Intermittent fever, B. Relapsing fever, C. Remittent fever, D. Constant fever. Correct answer D. Constant fever. 52. Which of the following laws is not applicable in respiratory physiology? A. Avogadro's law, B. Landsteiner's law, C. Boyle's law, D. Charles's law. Correct answer B. Landsteiner's law. 53. Elevated, solid lesion below 0.05 cm in diameter are called A. Macule, B. Vesicle, C. Pustules, D. Papule. Correct answer D. Papule. 54. Calcitonin hormone is secreted by which of the following glands? A. Thyroid, B. Parathyroid, C. Adrenal cortex, D. Pancreas. Correct answer A. Thyroid. 55. Which of the following is antifungal agent? A. Ketoconazole, B. Tetracycline, C. Hydrochlorothiazide, D. Methotrexate. Correct answer A. Ketoconazole. 56. During pasteurization of milk using flash method, what should be the temperature? A. 77 degrees centigrade, B. 72 degrees centigrade, C. 82 degrees centigrade, D. 63 degrees centigrade. Correct answer B. 72 degrees centigrade. 57. Which of the following is the national level system that provides national as well as state level reliable estimates of fertility and mortality? A. Ad hoc survey, B. Civil registration system, C. Census, D. Sample registration system. Correct answer D. Sample registration system. 58. Which of the following is an example of synovial joint? A. Ball and socket joint, B. Synchondrosis, C. Syndesmosis, D. Gomphosis. Correct answer A. Ball and socket joint. 59. Bluish, well demarcated spots on the buttocks and trunk in normal infants during first week of life are called A. Erythema toxicum, B. Milia, C. Stark bites, D. Mongolian spots. Correct answer D. Mongolian spots. 60. Sympathetic nerve fibers originate in the spinal cord along with spinal nerves between which of the following cord segments? A. S1-S5, B. T1-L2, C. L3-L5, D. C1-C8. करेक्ट आंसर बी T1-L2। कैसी लगी यह वीडियो कमेंट करके बताएं। अगर अच्छी लगी तो अपनी दोस्तों के साथ शेयर करना। एंड डोंट फॉरगेट टू सब्सक्राइब। थैंक्स फॉर वॉचिंग। सी यू इन नेक्स्ट वीडियोज।